So now I want to just take a few minutes and play our little rapid fire game called Myth or Fact.
Okay,
so I have 3 questions for you. Tell me if it's a myth or a fact.
Okay.
So the first one, myth or fact. Botox and fillers can prevent new wrinkles.
I would put that into the fact category. So there's patients where they're getting to an age where they might typically start to develop wrinkles, and if we're going in and relaxing those muscles before they have a chance to overwork them and develop those deep lines, that you can prevent or at least end up with wrinkles that are going to be less substantial than if you don't. Right, Botoxing it starting at age 20 is not going to prevent you, make you look like you're 20 when you're 80.
Yeah.
But the wrinkles that you will develop will probably be they'll come on more slowly and they'll be less intense.
So myth or fact that the result of Botox and fillers are immediate.
Oh, that's a myth for one, and it's a fact for the other. So that's kind of like a dual part there because you combine this into question. So Botox you do not see right away, and that applies to Botox or any of the neuromodulators because it just takes time to kick in. Botox, we're talking about the range of anywhere from, let's say, 3 to 7 days to see the full effect. So for patients and for the providers, it's not as gratifying because they don't walk out looking with, having the look that they've just paid you for.
Yeah.
And it's a little bit harder as the doctor to say, okay, did I use the right amount for this person's face? Because everybody's Botox number or however many units they need of any neuromodulator is going to be a bit different. So sometimes it takes time to learn somebody's face to figure out, how do I get the result that we all agree is a good result for this person's face? With filler, it's beautiful because you get this immediate response. So, even taking a lip and dividing it into 4 parts, we'll start on, this quarter of the lip, and then we take the mirror and show it to the patient. We get to look at it and say, that looks really good. The patient gets to say, yeah, I agree, that looks really good. Yeah. And then we can decide, do you want to push it a little bit more? Are we okay? But you get this immediate result. So patients would walk out looking like they expect to look.
Wow.
Yeah, it's fun.
Well, the last one, myth or fact, you can fit a Botox or filler appointment in your lunch break.
Big fact, for sure. Yeah, this is something that doesn't take particularly long. It's like a tummy tuck where you're there for the entire day.
Yeah.
People do that all the time. They come in for a lunch break or their coffee break or whatever it is, especially if they've had it before and we know the patient, we know their routine, we know that, hey, they're here for their 3-month check and we know how many Botox, because we make these little maps. Absolutely. Some of these visits can be 5-10 minutes.
Wow.
Yeah.
Wow, so quick.
Yeah.
Well, thank you so much. That was so informative. We learned so much about Botox and injectable fillers. And so I appreciate your time, Dr. West.
I appreciate yours.
Thanks. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card. For more information, visit carecredit.com.